Heart disease rarely starts with symptoms. It often develops silently over decades. I'm Dr. Mona Shah, triple board certified cardiologist. I'm passionate about prevention, early detection, whole heart care, and longevity. Today, I want to talk about how one of the mistakes that we make in heart disease is waiting for symptoms to occur before we start treating people and patients for heart disease. Did you know that 50% of people who have heart attacks, their first sign or symptom of any heart disease at all was that heart attack? It begs the question, are we waiting too long to have early detection? Are we waiting too long to figure out how to treat somebody ahead of time so they can avoid that heart attack? I'm passionate about proactive care, not reactive care. Oftentimes I get a call saying, hey doc, you know, my best friend just had a heart attack and he was fine. He was healthy. He just ran a marathon. In fact, he may have even passed a stress test. Most of us know somebody who has had a heart attack when we thought they were healthy. And then we question ourselves, wait, could this happen to me? And how do we know? So stress tests are designed to pick up blockages that are severe, causing chest pain, causing symptoms. It doesn't detect heart disease early. And I'm going to talk about in future videos how we can detect heart disease early. 60 to 80% of people who actually have heart attacks, their blockage was under 50% when they had that heart attack. How does that happen? So if you look at heart arteries, this is what we're trying to avoid. We're trying to avoid this volcano, this rupture of a plaque. We normally are starting here when we're young. We start with a little bit of plaque buildup and heart disease. And oftentimes we can live with this for the rest of our lives. We won't have symptoms, we'll pass a stress test, but how do we avoid this to go to this? Because that's what happens in 50% of people with a heart attack. Heart attacks don't just happen when you have a severe blockage. And again, I'm going to say this again. 50% of people who have a heart attack, they had no symptoms, they had no warning signs, and then they had a heart attack. 60 to 80% of people actually had blockages under 50%, and then the cap, the plaque underneath ruptured and caused this. I'm not telling you all this to cause fear, but let's figure out how can we decrease the inflammation going on in the arteries? How can we decrease the cholesterol plaques? How can we decrease the blood clotting that forms when we have the heart attack? I'm passionate about figuring out not only heart disease and preventing heart disease, but also what biomarkers are important. And then once we put that whole picture together, how can we actually implement change? What can we actually do? Okay, now I know. I've had a scan and I have 20, 30, 40% blockages. Now what can I do? How do I change my diet? How do I work on stress management? What exercises are important? What supplements can help me? And even medications that really could help prevent that heart attack from happening. Because early detection is key. We don't know until we know. Do we really want to live our lives with our heads in the sand until we're in the hospital with that heart attack? Let's talk more about prevention. Let's talk more about early detection. In future videos, I'm going to dive really deep into what scans are important, what stress tests actually show, and where there's benefit for those testing. What about biomarkers? What are the labs we should get? What are labs you can ask your doctor to get? What are tests you can ask your doctor to do for you? And then what? How do we change our diet? There's so many videos out there. Google, ChatGPT, and do this diet and do that diet. I'm going to dive into what really the evidence shows and where the diet changes can actually help protect you. We're going to talk about supplements. We're going to talk about medications and overall optimal heart care so you can prevent heart disease and treat it before that heart attack or symptoms actually happen. If you like these kind of videos and want to hear more, please subscribe for more.